in terms of getting these to come back to you just online, but do you have to?
No, I have to get somebody here to apply for me on my behalf. So strange. Are you based in Singapore?
I am.
Okay.
I think passports, visas aren't that much of a problem.
Right.
But then when it's a problem, I'm very sympathetic to need to get this sort of right. Such a pain in the backside. Someone's rights. Based in Bangalore, is that right?
Yeah. So you're gonna kind of be like, you're not moderating.
No, they got graded me. I'm not a moderator at all. It's really going to be yourself, Pavel, and Charlotte speaking. As we said on the call last week, more interactive, better. And absolutely do think that without less of a moderator, more co-creators as well. Okay, so any questions, any feedback, I think that's good to post as well. My role would just be to help with some of the Q&A for the audience, so that might be better to help. And in fact, I thought I was going to have to help manage online Q&A for someone.
Right.
So I've had the easier job of organizing. Right. You can decide it.
Right. Okay. Cool. And I understand that Pavel will start with introducing the report and stuff.
Actually, I was going to mention it. I might just do it for months since I can see what. Like you want to sit on.
I didn't see the agenda more closely before, but I thought it could be useful for the audience to have a proper introduction to the report itself.
Pavel and I were just chatting about how to get it out to people. I think that.
Good morning.
You know, at least to talk about who the workshops were with, what were the main findings, that kind of thing.
In this version that I'll send around this morning, the more detailed Q&A.
But actually, I haven't.
You not see it? I think it reflects. He says it reflects worked on.
Okay.
So don't worry, it's not suddenly like everything's upside down.
The draft script, yeah. Sorry, I totally missed this.
So you just search for the latest email from Pavel. It came through at 10:40.
Yeah, I see it.
Yeah, part B. Subbullet there where it talks about describing the compendium.
Reads good, but I feel like some of the questions to me are redundant. I mean, sorry, repetitive, because it kind of keeps going back to the Asian experience. But it's okay. Let's not give. I mean, sorry to give you that feedback now. I should have seen this in written. I think it should be fine. It's okay. Oh my God. It's transcribing what I'm telling you right now. Is this going to be recorded for later and available online? Well, I think I'm going to talk about the Indian health stack. No, but no, I think I will. I found the room. Yeah, because I kept asking people how to find the room, and they were like, when it starts, you will see it on the board. That might be a bit too late at that point. Oh, yeah.
Great. So, no worries. Thank you, everyone. I'll start again. Delegates, thank you very much to those of you who are joining in the room and to everyone joining online.
Recording in
This is our
progress.
session on protecting the healthcare sector from cyber harms. My name is Michael Karimian. I'm a director on Microsoft's digital diplomacy team. I am based here in Singapore, where I work with government, civil society, and the private sector across the region to advance a rules-based order online, especially in the face of rising nation-state threats. Now, since the beginning of the COVID-19 pandemic, those threats in particular have increased as it relates to the healthcare sector, very unsurprisingly. And so colleagues have been working with stakeholders across the world to identify how we can all take steps to improve the protection of the healthcare sector in the face of those rising cyber threats. I have a relatively easy job. I'm actually just here as a facilitator to help with the Q&A. My colleague Pavel will actually be the moderator. And so without any further ado, Pavel, over to you.
Michael, thank you for the warm words of welcome. And I would like to welcome the multi-stakeholder community joining us either physically in Singapore or joining us online in this session titled Protecting the Healthcare Sector from Cyber Harm, which is taking place as a part of Asia-Pacific Regional Internet's Governance Forum. My name is Pavel Mraz. I am a senior project manager in the digital diplomacy team at Microsoft, and it's my great pleasure to be moderating today's panel. This will be a hybrid session, so we very much hope that those connecting with us online and the audience in the room will pose questions. For those connecting online, feel free to raise your hand in the appropriate segment of the session or just drop your questions in the chat. And like Michael said, today we'll be exploring the opportunities and challenges related to the digitalization of critical health services in the Asia-Pacific region and globally. And for that, we have a great panel today composed of true experts. And I'm very honored to be joined by Charlotte Lindsey and Nayantara Ranganathan today. For brief introduction, Charlotte Lindsey is Charlotte is joining us online. You can see her on the camera, and she is the Chief Public Policy Officer at the CyberPeace Institute, or as it is known, the CPI, which is an independent NGO based in Geneva, Switzerland, whose mission is to ensure the rights of people to security, dignity, and equity in cyberspace is assured. The Institute works in close collaboration with relevant partners to reduce the harms from cyber attack on people's lives worldwide. And at the CyberPeace Institute, Charlotte is responsible for public policy, public and corporate communications, and the CPI Senior Humanitarian Advisor. Previously, Charlotte also worked in senior executive positions on digitalization of organizations, tech policy and diplomacy, multilateral engagement, data and digital risk, as well as security and crisis management. She has overall spent some 30 years working in the humanitarian sector, including 10 years as a director of communication and information management at the ICRC, and held number of other positions at the ICRC headquarters and also more adventurous positions in the field. So Charlotte, it's a pleasure to have you here at the panel. I hope we're coming in through clear through and fine. Good morning to you to Geneva.
Good morning. Thank you. Yes, you're coming through nice and loudly and clearly. Thank you. It's good to be here.
Thank you, Charlotte. And it's always a relief that everything is working with these hybrid sessions. So pleasure to hear your voice. And next we have Nayantara Ranganathan, who is joining us physically in Singapore in the room. Nayantara is a senior research fellow and a lawyer working on the politics and cultures of technologies at the Digital Asia Hub, which is an independent non-profit internet and society research think tank based in Hong Kong. This institution serves as a non-partisan, open and collaborative platform for research, knowledge sharing and capacity building related to internet and society issues with focus on digital Asia. She studies, teaches, and writes about the political economy of data and its relationship with the law. She also pursues an interdisciplinary practice, including through artistic methods and journalistic investigation, and has a keen interest in legal and media theories. She co-funded the Persuasion Lab, a project on political advertising on social media. And previously, Nayantara also worked at the Internet Democracy Project, where she developed work related to freedom of expression, surveillance, net neutrality, and the gendered use of the internet. We're extremely pleased to have you, Nayantara, joining us today at the panel to leverage your unique expertise and insight into data security and also the Indian and South Asian technology and data governance ecosystems. I hope we're coming through clear and fine, and we have you in the room.
Thanks for inviting me on the panel, Pavel. Yeah, and you're totally clear and fine. Yes.
Thank you. It's a pleasure to be with you, at least virtually. And last but not least, I need to thank Michael Karimian, who already spoke before me today, but he's the reason why we're all meeting here today. He pulled the panel together and he did a tremendous amount of work in this regard. So thank you so much, Michael, for being with us today and for supporting us. And with that, I would like to move to the panel itself, which we decided to divide in 3 segments. First, we would like to talk about the threats and raising awareness about the cyber attacks against the healthcare sector and the impacts that these attacks have on individuals. Then we would like to move to discussing some lessons learned from past attacks and some best practices that can be implemented at the level of organizations, at the level of states, but also at the international level to mitigate these challenges. And lastly, we would like to turn it over to you, to our audience, both virtually and in the room, for your questions, remarks, and insights about these practices. Just a brief setup from Microsoft here. From our view, protecting the healthcare sector from cyber harm is one of today's great challenges. Due to our unique visibility into the digital system, we have seen cyber attacks against hospitals, pharmaceutical companies, and vaccine research institutions across the globe, from Czech Republic and Ireland to Singapore and Thailand, among others. Such attacks hamper the delivery and access to essential services, and they threaten potentially devastating humanitarian consequences for people everywhere. In the past, the healthcare sector has been severely impacted by major cyber incidents, such as the WannaCry, NotPetya, and countless others. But unfortunately, the volume of cyber attacks affecting the healthcare sector has increased dramatically since the start of the COVID-19 pandemic. In the last 2 years, we have seen a disturbing increase, targeting various organizations providing essential services. Between June 2020 and December 2021 alone, we recorded a total of 235 cyber incidents affecting hospitals in 35 countries around the world, and the number unfortunately continues to grow. Medical staff and healthcare facilities are who were already under immense pressure due to the enormous medical needs generated by the pandemic, now had to also deal with the surge of sophisticated and opportunistic cyber attacks, including ransomware attacks, at a time when societies needed the sector the most. In a number of cases, this had direct impact on patients whose treatments were delayed or postponed. And I'm very pleased to have Charlotte from CPI today with us, because CPI has really been at the forefront of documenting the human impact that cyber attacks have on individuals. So Charlotte, the first question I would like to ask you today is, why is the protection of the healthcare sector from cyber harm so important? And what are you seeing from the CyberPeace Institute perspective in terms of the impacts on individuals? Over to you, Charlotte.
Thank you very much. And thank you for that great introduction, because it's a real scene setter for this subject today. I think the protection of the healthcare sector from cyber harm is so important, because I think what we fundamentally forget is this isn't about technology, it's about people, and that the harm to people from cyber attacks is often the part that is most hidden, because the focus is very much on the disruption to the hospital or the disruption to technology. But attacks on healthcare are fundamentally about attacks on people. And these attacks, whether they're perpetrated by cyber or kinetic means, are attacks on all of us, because they are hampering the delivery and access to what are essential services. And there are potentially devastating consequences if people cannot receive medical care or treatment as they need it. And that can also have enormous psychological harm as well as physical harm, because people can lose trust and in the ability to actually secure medical treatment when they need it. So when the healthcare sector is attacked, there's an individual, both physical and psychological harm to the health and the well-being of individuals, be they patients who need care, or be they the medical staff or healthcare staff who are not able to carry out the treatment that they're there to give because of the disruption caused by cyber attacks. So the harm is very much profoundly human. And I think that's something that we have to keep at the core of what we're looking at. Whether the attacks hit the media headline or not, those cyber attacks are ongoing and they're a persistent reality, and therefore they're really impacting people who are reliant on vital services. And as you mentioned, there has been a ramping up of attacks during COVID-19 pandemic when the healthcare sector was already vulnerable, which means it was compounding that vulnerability and compounding the risks to people's health and lives. And I think that's absolutely that cynical attacks on the healthcare sector, particularly during a pandemic, show a total disregard for human life. And I think that's really critical. So I'd like to stop there, and then I can come back a little later to some of those impacts.
No, thank you, Charlotte. This is really insightful, and I couldn't agree with you more on the point you've made that attacks on hospitals are truly fundamentally attacks on people. And as we do not tolerate attacks on hospitals in the physical world, neither should we tolerate attacks on hospitals in cyberspace that can have as devastating consequences. And you also rightly pointed out that the vulnerability will likely continue to grow into the future. As digital services digitalize across the world, then we're likely to become more vulnerable. And we have seen that the opportunistic cyber attacks will not skip hospitals just because it's an essential service. It's perhaps why they will be targeted more. And with that, I would like to turn this over to Nayantara with the next question. And that would be, what is the experience in the Asia Pacific and perhaps India when it comes down to cybersecurity and healthcare sector? Can you give us some insights as to where the cybersecurity ecosystem is at the moment, and what are the major concerns and some of the challenges there, and perhaps what works and what doesn't work? Over to you, Nayantara.
Sure, thanks, Pavel. I think there is fairly a high incidence of cybersecurity events in the Asia Pacific region as well as in India. And in your report, by cybersecurity incidents, you reference ransomware attacks, spear phishing, data breaches, whether of the hospitals themselves or of third parties and so on. So some of these are very common in Asian countries, but what kind of aggravates the issue is that many Asian jurisdictions like India also don't have formal data protection laws, let alone data protection measures for, like specific kinds of sensitive data like health data. And also the national emergency response teams in incidents like where cybersecurity incidents should kind of prompt a swift action or some kind of disclosure to the people that are affected. That is also very much on a back foot, and sometimes could be counterproductive to get in touch with some of these organizations. So this means that the exposure of the sensitive health data is extremely high, because both private sector actors as well as governments are kind of leading the way in collecting more and more this kind of data. So I kind of confirm your findings that there is a lot of these incidents happening in the region.
Nayantara, thank you so much for that answer. And I think, as you rightly mentioned, there are a number of steps that could be taken at the national level, including at the level of legislation, to ensure better data protection, especially when it comes down to sensitive information such as personal health information. And I'm sure we will discuss many of those later on as we move in the discussion. For now, I would like to turn back to Charlotte for a next question. And you have mentioned the Institute's work in terms of documenting the impact on individuals, but I know you have also been very comprehensive in your work. You have been tracking cyber attacks on hospitals as the CyberPeace Institute for quite some time. And I was wondering if you could tell us more about the tracking work that you have done in this space, and importantly, whether you have some results to share. For example, has there been evolution of the threat and harm facing the healthcare sector over the years? And what should we be preparing for in the future? Over to you, Charlotte.
Thank you. So yes, the CyberPeace Institute has been tracking for more than 2 years now incidences of cyber attacks against the healthcare sector. And we have recorded over the last 2 years 447 disruptive cyber attacks against healthcare organizations, affecting some 40 countries, which is averaging about 4.2 attacks per week. And that's really just based on publicly available information. So it's probably the tip of the iceberg of what's really happening, because it's not always reporting or publicly available information. So I think the Institute, when we launched a cyber incident tracer in 2021 on these healthcare attacks to make this information publicly available so that it can provide visibility and evidence about cyber attacks to show really the impact of these attacks. What we have found so far from this is there has been severe operational disruption to services, which have lasted from either a matter of hours to up to 4 months in some healthcare incidences. And that's averaging over 19 days per incident of disruption to services. We also, as you mentioned previously, the issue of the data or records breach. The number of records breached or the patient's data impacted following attack, we aggregated, it's over 2.4 million data points, which is around 155,000 records per attack which have been breached. And we saw also that in 57% of the incidences, systems went offline, and 73% of incidences, data was leaked or exposed. This is incidences where people's data is vulnerable, has been exposed publicly. And this can be highly sensitive information on people and their healthcare. What we also saw is disruptive cyber attacks hit 169 different patient care services in countries. And that can mean the diversion of ambulances or incoming patients into hospitals for emergency care. And we saw also the cancellation of appointments or surgeries in 21% of the incidences. So that really highlights that it is very disruptive to ongoing care. And to highlight some of the trends, what we see is that ransomware has very much been the dominant threat. And that's been incredibly disruptive to healthcare services. And we, in the incidences that we have recorded, 86% of the documented attacks were linked to ransomware. So to put that into some sort of perspective, every 2 days over the last 24 months, a ransomware attack has impacted a healthcare organization, including patient care services or entire healthcare networks, or the production of vaccines, as you mentioned, at pharmaceutical companies. So these cyber attacks that we have been collecting, it's really based, as I mentioned, on publicly available information. So that is probably really not an indication of what the problem is, but not necessarily all the information that's available. So since we have started really working on this, we've also seen beyond ransomware, data breaches and other disruptive attacks. And what we feel that's coming out of this work is it's absolutely vital to recognize and to be aware of this information, because this can help drive greater awareness of the problem and also drive greater response to the problem, so that we can give the due protection that's needed to the healthcare sector, so that it remains a vital service for people that they can trust will be able to be delivered when they need it.
Charlotte, thank you so much for this. And I have to say, these are some truly sobering numbers. And it is truly wonderful that the CPI is doing this work, because providing visibility and evidence is the first step we need to get policymakers on board to understand the growing threat and the growing need to invest resources, both financial and human resources, to start mitigating the threat. And also, it's sort of to level the playing field, because some countries, especially those that have already experienced cyber attacks and do have this unfortunate experience, also have best practices to share. So it's very important to spread the message, and we appreciate that the CyberPeace Institute is doing that. This brings me to my next question, which was to Nayantara, and perhaps looking at your experience and your visibility into the regional ecosystem, what are some of the important factors and trends in how cybersecurity risks are understood in the local context? And especially considering that some economies can still be considered emerging markets for data. So as you mentioned before, there might be this intention to just collect more data without thinking about the security. So over to you, Nayantara, for any thoughts you may have on this.
Thanks, Pavel. You're right. I think we can't talk about the cybersecurity risks without talking about the data economy. And by that, I mean that there is a certain developmental imperative that certain regions in the global south face to find prosperity through the accumulation of more and more data and perhaps building products on top of it and so on. What many private sector actors like to call regions that are data rich. So especially during and after, since COVID struck, there has been a big push in digitizing and in general, like intensifying the kind of data that is collected in the healthcare sector, the kind of digitization of processes that might have existed beforehand, uniquely identifying patients and in general, creating more and more data, with the idea that different kinds of actors, whether it is startups, private sector, the government, and so on, are able to provide innovative solutions or build products on top of this kind of data. And I think this in itself increases the kind of risk that this data, of course, then faces. So there is a question of I guess you can't talk about minimizing cybersecurity risks without talking about the imperatives that exist in certain regions that might not be the case in North America or in Europe, and the kind of experimental products built on top of this data and the kind of exposure that they face, if that makes sense.
No, thank you, Nayantara. It makes perfect sense. And I think what you mentioned about the minimizing risk is very interesting, because it is a double-edged sword. The digitalization offers tremendous opportunities that countries want to tap, but also profound security and human challenges. And it's ironic that some of the countries that have already digitalized their public services to a great degree have a much darker view of the potential security concerns, because they have already experienced breaches, such as Estonia, whose entire social security system was attacked in, I believe it was in 2008, and then critical services were not available. Whereas in many developing countries, there is a lot of excitement about digitalizing their economy and the opportunities that it brings. But as we move forward, we need to make sure that this is also balanced and done in a secure way, so that we don't create new vulnerabilities down the road. And this also brings me to the second theme for today's debate. Apart from the threats and raising awareness, the international response and what the international community can do to truly protect critical services such as healthcare from cyber threats. The recognition, fortunately, at the international level that this is a real concern is growing. The international community has agreed repeatedly on the importance of protecting critical infrastructure from cyber harm. For example, the 2015 report of UN Group of Government Experts on Cybersecurity has already committed all states to protect critical infrastructure from cyber threats. And all states have agreed not to conduct or knowingly support cyber activity that would damage or impair critical infrastructure. At the same time, recognizing the global scope of the problem, the multi-stakeholder community issued a call to governments in the midst of the COVID-19 pandemic to draw attention to the rise of cyber attacks on healthcare specifically, and call to stop these attacks. Concurrently, in the midst of the pandemic, the government of Australia, the Czech Republic, and many others have successfully pushed for the UN to recognize that healthcare sector is a critical infrastructure and should be protected by all means necessary. However, the global interdependence of the healthcare sector requires that we follow up with a decisive multi-stakeholder action spanning diplomatic, operational, policy, and capacity building initiatives, as well as ensuring accountability for perpetrators of cyber attacks that violate international norms. And obviously, we also need to ensure the commitments the UN makes do not remain on paper, but are appropriately operationalized. And that brings me to my next question to Charlotte. With the UN having recently designated medical facilities as critical infrastructure, how do we promote greater accountability for malicious cyber behavior internationally? And what is the role of diplomacy and international law in this space? Over to you, Charlotte.
Thank you. Yes, I think given the types of attacks that we're seeing against the healthcare sector, urgent action is needed. And I think that that's really important that we underline that this is a time of where we need really comprehensive action. And as you mentioned, it's across technical and operational, policy, diplomatic, and of course, the healthcare communities themselves. And I think fundamentally, it's to your question, it's about recognizing we can't defend our way out of this problem. We have to use all of the measures that are possible to try to bring greater accountability for malicious cyber behavior. And I think accountability, as you mentioned, the implementation of norms is absolutely critical because those norms are there for responsible state behavior in cyberspace. And so that's absolutely critical that there is better respect for an implementation of those norms. And I think recognizing also the interdependence of the healthcare sector, it's also important of this sort of more decisive multi-stakeholder action, because it is not one action in one area alone that is going to improve the situation. It will need to be multi-stakeholder action spanning the sort of diplomatic, operational policy and capacity building initiatives and accountability. And I would like to just start with accountability. And I think accountability is very, very important. And that starts with, proper investigation of cyber attacks and then holding people to account. So identifying what are the norms or laws that have been breached, and then ensuring that there is a thorough investigation, and then ensuring that there is cooperation and collaboration to bring perpetrators to justice, because that is a really important part of accountability, both at all levels, but particularly for the victims of cyber attacks, to know that their decisive action is being taken. And that will need collaboration and cooperation. And then regarding the importance of diplomatic measures, I mean, this is really a moment when there will need to be collaboration and cooperation to ensure that we're advancing the implementation of the UN cyber norms through really concrete action, that they are implemented and it becomes very concrete with very practical action to protect the healthcare sector and to improve its resilience through also best practices, lessons learned, as you mentioned, which are really, really important, and how those lessons learned can help influence policy and international law and norms. So I think that is really, really important, that this is raised, it doesn't remain just a problem that is localized with those who are attacked, but all issues that throughout the chain of those who can take action, that action is really taken on the accountability and diplomatic fronts.
No, thank you so much, Charlotte. And this actually is a perfect segue to the next discussion we wanted to have that's more concrete about lessons learned and best practices, because following the UN decision to designate the healthcare sector as critical infrastructure under applicable norm, the CyberPeace, Microsoft, and the government of the Czech Republic partnered together to undertake a year-long project to ensure that the commitments that the UN make do not remain only on paper. And the goal of this one-year project was to identify critical gaps that need to be addressed to protect the healthcare sector from cyber harm. But the way this was done was bringing the multi-stakeholder community together, recognizing that diplomats do not have all the solutions, capacity buildings do not have all the solutions, or the national legislators or IT experts do not have all the solutions. So we brought together the cyber and healthcare communities throughout the year for a series of 6 workshops and discussed a number of issues, from hospital IT systems to organizational challenges faced by doctors and nurses on the front lines of response to cyber attacks, to national resilience measures, capacity building, and all the way to the question that you, Charlotte, mentioned of international law and building normative taboos about cyber attacks, and also the question of what diplomats can do internationally to strengthen the protection of the sector and ensure accountability for violators. During these workshops, we distilled key recommendations, lessons learned, and good practices from a diverse group of experts. And based on what we've heard and learned from these discussions, we have developed a compendium of multi-stakeholder practices on protecting the healthcare sector from cyber harm. And this offers healthcare institutions, but also governments, international organizations, and other stakeholders a resource to support their efforts to safeguard the healthcare sector from cyber threats. I should add that we have recently launched this compendium in July 2022 during the session of the UN Open-Ended Working Group on Cybersecurity in New York. Though driven by Microsoft and CPI in Czech Republic, this was truly multi-stakeholder efforts. Many governments, civil society, and industry representatives contributed to this project, including the government of Singapore, Netherlands, Australia, Ireland, Canada, and others who all experienced their own attacks on healthcare systems in cyberspace. And although also I should mention some of the many other contributors to this project, such as the Doctors Without Borders, the staff of the ICRC, the doctors and IT professionals who actually work in medical facilities and have to secure the systems and face these attacks firsthand. And I think this is a very useful resource to discuss, because as we discuss the problem, we should also look into potential solution. And I would now like to turn it back to our panelists to discuss in greater detail some of the findings that are contained in this compendium. And I would like to start with Nayantara, since our project has drawn mostly on experiences of practitioners from Europe, North America, and even Singapore, where cybersecurity maturity is relatively high. Can you speak to the differences, Nayantara, between more developed and less developed countries in the region, and perhaps there are lessons learned that we should take beyond what's contained in this compendium? Over to you, Nayantara.
Yeah, thanks. I don't want to generalize beyond what I should, but I think there is, in the report, you speak about underfunding of underfunded, understaffed kind of cybersecurity operations in the healthcare sector, but I think a lot of the healthcare sector itself is underfunded in many parts of the world. Having said that, I think one thing that I realized also reading your report was that this framework of cybersecurity draws heavily from kind of disciplines that study armed conflict and international relations and kind of state and non-state actors and so on. And it's a very, in its language, imagery, a very militarized kind of discourse. And often I think that puts a lot of distance and mystification between the kind of problems that people face in their healthcare facilities and so on, and kind of makes it seem like very otherworldly sometimes. And I think one of the workshops in your report also spoke to that kind of a concern that when you say cyber attack, it's also true that a lot of disinformation campaigns, for example, that came up in the course of COVID-19 might qualify, you could argue that that is also a certain kind of cyber attack. So I think also, just kind of being mindful of the ways in which we speak about these problems, speak about the kind of issues around data breaches in healthcare facilities, I think is one way to bridge gaps. I don't know if I spoke to the gaps between the global north and the global south, but definitely at least within the discourse around cybersecurity and within practitioners, because indeed at the end of the day, I think one of the most fundamental things is that is understood by healthcare practitioners is that, for example, that patient information is kind of sacrosanct and isn't something that isn't public information. So there is, I think, principles that do underlie an understanding that could help cyber security norms Yeah, thanks.
No, thank you so much, Nayantara. And you make excellent points that also came out throughout our project. And the underfunding of the healthcare is something that we have faced with every practitioner that we have interviewed, including the medical staff that runs the hospitals and also the IT professionals who are charged with protecting the systems. Interestingly enough, one thing we found from discussing with both IT professionals and healthcare professionals was that even the institutions that are not underfunded still have a problem investing into cybersecurity. And that is mostly because of the culture, the management culture in a hospital. And it's a completely understandable conundrum because most hospitals, at least in the countries where we interviewed, are ran by doctors. And when doctors are faced with the impossible choice of investing into new life-saving machine or investing into cybersecurity, which is an abstract threat for them versus a machine that can save an X number of lives, they will always make the decision to invest into new life-saving machine. And that is something that is very difficult for them. So one solution that we came up with, especially in countries where the healthcare sector is publicly funded, might be to divide the budget and allocate specific resources for cybersecurity on a higher level, precisely so that doctors do not have to make these impossible choices. But it's very interesting. Also on the protecting private information, we have found that many hospitals do not build redundancies. So when the data is lost, it may be lost forever. There are ways to build redundancies, including creating backups and also perhaps moving the infrastructure to the cloud. On the disinformation campaigns, this is also something we discussed in the international law workshop, although it was a very challenging issue because what we focused on at that stage, given where the international discussions are, is just the recognition that humanitarian international law applies and that parties in the context of armed conflict, and we have seen cyber tools used as in the context of armed conflict already, so that parties do not attack critical infrastructure that is protected under international humanitarian law. And I would like to also turn this to Charlotte. Looking at the compendium of best practices that we co-authored with CPI and Czech Republic, what are some of the concrete steps that stakeholders at all levels can take to increase resilience of the healthcare sector, whether through capacity building, updating international and national legislation, or connecting the operational realities and demands at national level with diplomatic outcomes at the global level? Over to you, Charlotte.
Thank you. And thank you for that useful introduction to the compendium, because I think it is important to recognize that this was bringing sort of healthcare and cybersecurity communities together. And I think that is really critical. And I think what has come out of the compendium work is that to recognize really that increasing resilience for that healthcare sector is a shared responsibility. And so it is necessary to bring all of the actors together because everybody has a role to play. And I think what comes across clearly for me is sometimes it's the most simple steps that are really important and often the ones that we forget to take notice of. And that, for example, would be implementing good practices and recognizing the lessons learned from previous attacks, because it's only by learning from those lessons and recording and recognizing what steps need to be taken, can we actually advance and can we move forward? So I think that is absolutely critical. And I think the workshops for this process really brought together practitioners to try to understand what were some of the challenges that were faced and how to respond to those, and recognize that this really does require quite a change of both mindsets and culture inside cybersecurity for healthcare. And seeing also that this requires a sort of shift of approach from recognizing that cybersecurity is an enabler rather than a hindrance to the ability to deliver care. And I think it comes to your point, Pavel, that you were saying, well, where do doctors make the choice? Who runs hospitals? Whereas if this is really delivered in an engagement between all the practitioners that are responsible, and recognizing that with digitalization today, there isn't really a difference between the provision of healthcare and the technology which is providing that healthcare. And therefore, it's really, really important to secure that, and that there has been a definite shift in the way healthcare is provided, which is so dependent on technology, that unless there's a real engagement and partnership and understanding between all of the actors, then the right choices won't be made. And it shouldn't be left to one or two people to make those choices. It has to be really a collaborative process. So I think that for me is a very basic message that comes through from this work, but really, really important, because it is about medical staff, it's about IT personnel, it's about government representatives. And only if all of those parts work together will we be able to increase the resilience of the healthcare sector to attacks. And I think that one other key learning from that whole process is just that importance of collaboration and communication and information sharing. And I mentioned it earlier in the work that we've been doing to track the attacks, but that is really, really important, because then you can understand better the threat landscape. And that's really something that came out clearly from the work of the Compendium. If you can understand better the threat landscape, you can also then it can help you to inform and share information and inform the right levels within the country about what has happened. For example, national cybersecurity authorities or others. And that's really, really important to know what's the chain of information sharing that's really important, not only to respond to the attack that's happened, but also to be better prepared in the future. And I would say that also what has come out strongly is the need for policymakers to be aware of that and to have really concrete information and data to help them understand the scale and the scope of the problem, because that can influence policy, as we mentioned at the beginning. I would also just like to add that I think all the participants from all of the different work streams of the Compendium process really wanted to urge states to sort of amplify a much more human-centric approach to cybersecurity and the real human costs of cyber attacks. And rightly, we started with that at this on this session today, but underlining the sort of importance of a human-centric approach, the human costs of cyber attacks against critical infrastructure like healthcare, and that there is a sort of it needs to generate the sort of political will to increase investment into health sectors, cyber resilience, and that is a very important recognition. And I think that for participants today, it will be really interesting for them to also investigate a little more into the Compendium findings, because there's some very practical recommendations in there coming from these workshops that can really help find very simple and systematic ways to try to really build cyber resilience in the healthcare sector, recognizing that it is all of those steps together that will really build that resilience and also can help then achieve more progress on the diplomatic front, because that will really depend on the ability of the international community to really harness those findings that are coming out of work that's being done to understand better the attacks on the healthcare sector, and then look at how does that really translate into diplomatic and policy recommendations.
Thank you so much, Charlotte. And I could not agree more. What struck me the most is that a multi-stakeholder project like this can really create outcomes that are bigger than the sums of its part. The project ironically very much helped in the countries where cyber attacks happened, because we brought together diplomats, national legislators, people who run the hospitals, and just by putting people in the same room and making them speak about the problem from their different perspectives, it was already a community building and a trust building exercise that then carries over to them being able to act as one on a national level to advance this agenda. And I think the next question you've mentioned on the diplomatic measures is very timely indeed, because the UN is currently considering establishing a permanent forum on cybersecurity, one that would support all countries, including through financial resources, in implementing the cyber norms that we already have. Because it is not a straightforward exercise. With this compendium that we did, we hope to provide some advice and recommendation how to implement the healthcare norm specifically, but there are so many other norms that remain unimplemented. And let's hope that this will indeed go forward. I would also like to, knowing that we're almost at time, I would like to turn it to Nayantara for the similar question. But before I do, I would like to very much encourage the audience to raise their hand virtually if they have question, or ask for a microphone in the audience, as we would very much like to take your questions as well. And for those joining us virtually, I did drop a link to the compendium in the chat box. So please feel free to check it out. And with that, over to Nayantara. If there is a recommendation in the compendium that struck you as particularly useful or surprising, that would be really helpful for us to know. Over to you.
Yeah, I'll keep it short. I think that the compendium addresses some structural shortcomings of the lack of cybersecurity in the sense of funding, in the sense of getting buy-in from senior staff and management. So I think that, and what I already mentioned about what do we think of as cybersecurity when we think of the word, and then kind of like expanding that to also incorporate, I think you call it infodemics, but different kinds of information warfare mechanisms. So I think we still have some time for audience questions.
Absolutely. And so if there's anyone in the room who has a question, I see we would have one person. Everyone else, please feel free to come up to the microphone in the center of the room to raise your question. I think we have about 3 speakers in the room who would like to raise questions. And indeed, anyone else online, please raise your hand or put a question in the Q&A. I believe one of my colleagues who's helping to facilitate the session will make sure we're aware of them. But first, please introduce yourself and tell us your question.
Okay, right. Thank you. Kenny Huang, Executive Council Member of APrIGF, CEO of TDMNIC. And thank you for raising the critical importance of the cyber norm. And I just one comment, because the cybersecurity could be covered several stakeholders, and they are actually cybersecurity cover the entire supply chain from top to the government and down to every single individual actually are covered. They are actually responsible for their personal cybersecurity. So I would suggest probably you can classify different stakeholders into different groups, and also giving a different cyber norm, for example, like from the government and UNCCE already defined property behavior for the stakeholder, so they can follow the cyber norm based on the UN recommendation. And probably more elaborate, you just mentioned UN could be develop more sustainable initiative or action, so that that's some way the government can follow that kind of direction. And second group, you probably can also classify the key stakeholder in the internet community. For example, many people here basically come from internet community. They probably belong to ICANN community, registry community, or address number community, or even IETF community. Different community probably can develop their own cyber norm. For example, like IETF, they can develop any security protocol that can regulate appropriate software behavior. And for example, like APrIGF or ICANN, we have a contractual relationship with our stakeholder. So based on the contractual relationship, we can enforce some appropriate behavior for the subscriber. And even for individual, actually a lot of cybersecurity threat is come from institution personnel, because they didn't manage their credential carefully. So they do need a capacity building for cyber hygiene. So that will be better for they understand that could be make sure they have do the proper cyber hygiene by themselves. That's my recommendation. Thank you.
Thank you, Kenny. Those are very thoughtful remarks and feedback. I think we have another question lined up.
I'm Zahir from Palestine. Thank you for discussing this very important topics. My question is, are some statistics about how these attacks solved? Because you mentioned in the session that 86% of the attacks is ransomware, and that's ransomware related to availability of the data. How the organization deals with this ransomware? Paid the ransomware, or lost the data forever, or recovered the data after 1 day, after 1 week, after 1 month? Is there some statistics? So let us sense the issue. Okay, thank you.
Thank you very much. Charlotte, you might perhaps have statistics on the response rate, or I don't know if that's collected or not. But before we turn over to you, just in the interest of time, are there any other questions from here in the audience, or any questions online? Please.
Thank you for the opportunity. So I'm Lokendra from India. And my question is, so has there been an attempt to profile the malicious actors behind these cyber attacks on healthcare institutions? Because, I mean, what are their motivations really? Like, I'm very interested in that, because on other sectors, I understand there may be commercial or geopolitical motivations, but on healthcare sector specifically. So either in the Compendium report that you mentioned, or whether CyberPeace Institute has done some work on profiling such malicious actors. Thank you.
Great, thank you very much. So two great questions, one on response and recovery rates, particularly in the context of ransomware attacks, and then also a question on the profile of the malicious actors. I don't know if anyone on the panel has any thoughts or specific answers on either of those questions. Otherwise, it definitely points to areas of future research, but over to the speakers.
Yeah, I think maybe Charlotte or Pavel is better placed to answer the question on statistics and on profiles.
Charlotte, go ahead. I see you taking a breath.
Yeah, no, so I think that, I mean, great questions. Thank you very much. And it's such a shame I'm not there with you in the room, because it seems that this could be a great dialogue that we could have if I was also present. I think that taking the question of profiling or identifying the malicious actors, I think that's probably one of the most complex parts of it. What we have done in the work of the CyberPeace Institute is try to record what is publicly available information. And so sometimes the actors themselves self-attribute. So they determine themselves, they say, we have done this, and we're able to collect information where they have proclaimed they have done it. In other incidences, we have been able to verify information that's come from national authorities or from press statements or statement from actors that we've been able to verify that would be a good source of information to say who the malicious actor was. Many cases, it isn't actually stated. And I think that's the real complexity about what's called attributing attacks, because there are technical attributions, there are legal, and there are political attributions. And it can be very, very difficult to identify who are those actors. I mean, what we say generically is that there are a very large range of actors that are involved in carrying out attacks against the healthcare sector. They can be state affiliated, they can be hacktivist groups, consortium, criminal actors, a whole range of different actors who are involved. But the attribution part is very complex. Where we have that information, we are including it in the publicly available information that we are putting out. So that's on this point. Pavel, did you want to add anything to that before I look at the next question that was raised?
Yes, I just wanted to add on the ransomware specifically, essentially from our understanding that there has been, the attacks on hospitals have been conducted by all types of malicious actors, including state-affiliated, state actors, and also non-state actors. And also significantly, just not to be only the bearer of bad news, some ransomware actors have actually publicly committed and pledged not to attack hospitals, which is the good development. Obviously, it would be better not to have ransomware attacks at all, but at least it shows that this work around the building up normative taboo against targeting the most essential and critical and vulnerable sectors that the whole society depends on, that this is a work on diplomatic and policy level that does make sense, and over time it can bear fruit. But over back to you, Charlotte, for answers on the other questions.
Thank you. And I think it is on the ransomware question, which was really and linked to also the data and whether data has been exposed and data is recovered. That again, it's very contextual, specific incident or specific attacks have very different responses to that. And sadly, I think most of the information that we're able to collect is placed there because criminal actors have also placed that information on the darknet or in the public space as part of the attack. And that means that once the data is already out there, it's very difficult to recover. And it's already, the vulnerability to the individual is already has already been made, and the vulnerability towards the medical infrastructure and the institute where the data has been breached from. So it's very difficult to answer that categorically, to say yes, you get the data back. It's very difficult. I mean, one of the key conclusions of the workshop on the compendiums was really around the resilience that's necessary in terms of the steps that healthcare facilities need to take to be able to better protect data, to ensure that data is able to be more secured, but also recovered in the event of an attack. But again, I would underline, once we have found information which is in the public domain about related to a data breach, it's very, very difficult to actually then know what happens in the long term regarding that, because it also may be that the data is actually held and not initially released because it's still part of double or triple extortion threats, which continue long after the attack has happened. And I think that that's one of the clear things that has come out of the work that we've done, is that attacks can last for a very long time, because once the breach has actually happened, it can take a long time to identify what are the impacts and the harms from that, including at what stage information may be released again into the public domain.
Wonderful, thank you very much. We have 3 people lined up to ask questions. In the interest of time, I will encourage them to ask their questions one after the other, and then we'll get answers. No pressure, but please be succinct. Please ask fascinating questions, but please also introduce yourself first of all.
Hi, my name is Joyce, and I'm from APrIGF. And I just wanted to thank you and the speakers for this session. It's very important what we're discussing today. There was a report that said last year in Australia, the healthcare sector was, for the first time, overtook the IT and communication sectors in terms of the most highly targeted sector or industry for Australia. So I'm just thinking now, with COVID, the pandemic and everything, and there's such a large footprint of people's information in many different sources, contact tracing apps, etc. Do you think, or would you recommend that there should be the establishment of more sector specific, so healthcare sector specific certs or C-certs, so computer emergency response teams? Or do you think that just having, the national certs, take care also of attacks in the healthcare sector would be sufficient? So I tried to do a Google search, and there just aren't many, healthcare specific cert teams. So I'm just curious about it. Thank you.
I'm Fandri from APrIGF Fellow. So my question is about regarding the soft law that already happen right now. So we have several documents such as Stalin Manual and also several memo from UNGGE regarding this issue of attacking for several critical infrastructure. Are you seeing this kind of document can be binding or can be implemented by the governments in local or regional levels regarding this kind of attack? Because yes, the document right now is focusing in the humanitarian resort, but I think in this peace condition, we can also use this soft law to implement several law or several policy that can helping this healthcare area from attacks, and also to making sure the process of how to see the state actor and non-state actor conduct in this sphere, because there are so many non-state actor that back up by state actor to doing several attacks in healthcare system in COVID situations. And I think there need a soft law that can be implemented in regional area. And I want to know what you think. Thank you.
Hello, hi. My name is Upasna. I'm an APrIGF fellow from India. So generally what I've noticed so far in my work in this space is that there are very poor practices like data management and data sharing practices that we see especially among like government employees, who one could argue is like the largest collector of health data. So I'm curious to know what is the role of private sector, because they do build a lot of health information management systems for large hospital chains. Like beyond just creating technology that has principles like security by design already integrated into it, like what is the role that they play in terms of building capacity of healthcare professionals and other stakeholders dealing with health data? Thank you.
Wonderful, 3 great questions. So just to summarize, a question on the pros and cons of sector-specific certs, a question on essentially the implementability of UN cyber norms, and a question on the roles and responsibilities of the private sector. We are short on time and we're keeping everyone from a coffee break, but Nayantara, maybe we'll start with you and then Charlotte and then Pavel.
I just have a quick response to the sector-specific certs. I just wonder how it would work in the sense that now movement data, for example, in the context of contact tracing is healthcare data, or like in a different context, somebody's sexual orientation could be healthcare data. So like, I think it's really difficult to think of like what is healthcare data without thinking of the context around it. And therefore I wonder to what extent there could be then, I don't know, overlaps and so on. But I don't have a direct answer to your question.
Thank you, Nayantara. Charlotte.
Yeah, great questions. Thank you. I will try to answer very quickly. I think that to the first question around healthcare and certs, I think what is really, really critical is that there is clear multi-stakeholder engagement across the board, and that experts that can also be coming from certs and other relevant subject matter experts are really, really engaged in all these processes to try to strengthen protection and resilience of the sector. So I think that's really important. And I think each country will have a very different process in that regard. But I think it's very important that subject matter experts are really brought into discussions about how to improve resilience. In terms of the Tallinn and other work that's been ongoing for years to try to develop clarity of that laws and norms, I think all of those processes are very important. I think we can learn a lot from those processes that have gone on around developing law for clarity of the law in times of conflict, for also helping for clarity about the law in times of peace. I think what is really critical about that is that international law, for example, has put very much protecting people at the heart of what it's been developed for. And I think that that's also very critical where we started from in this, keep it very human-centric and ensure that the steps that are taken are really putting people at the center of this to ensure that there are any action taken is and laws and norms taken are really taken from a human perspective and respecting the rights of individuals. And then on the last around protection by design or building systems by design, I mean, that is absolutely critical. And I think a greater collaboration between those who are developing the technology and those who have to use the technology is absolutely critical in terms of really understanding the sort of security by design, what's required, how it will be used.
Thank you, Charlotte. And Pavel, if you can please be the king of brevity and take us home.
I'll be very disciplined. On Australia, Australia has been a crucial ally in our quest at the UN and in implementing this project and introducing a new norm on healthcare protection. And it goes to the second question, can these documents, can these norms be binding? As a matter of fact, they already are. The critical infrastructure norm explicitly states that states should refrain from attacking critical infrastructure that's contrary to international law. So it's in this particular case, we have a number of bodies of law that already protect critical infrastructure from attacks in a physical space. So the argument, it's only about convincing countries that the commitments they have made in a physical world should be applied in cyberspace as we move into a new digital age. On the sector-specific cert, we did not make that recommendation because it would very much depend on the size of the country. There are some global organizations such as Health ISAC who focus on collecting cyber threat intelligence sharing in healthcare sector specifically, and that has worked quite well. In a small country like Czech Republic, like mine, It was the national CERT that responded to attacks on hospitals, and it's a very small country, so that worked well for us. So we did not want to prescribe a single model. And on what the private sector can do, that was the last question, and what role it can play in capacity building. I think one example is exactly this compendium, where we have joined our forces with a government and civil society organization to implement this compendium and project and to recommend best practices. But of course, beyond that, it's cyber skilling, financial capacity building program, and Microsoft has been doing all of these things across domains in cyberspace to make sure that our online environment is safer and rights respecting. And over back to you, Michael, for final thoughts.
Thank you, Pavel. Really just a thank you to everyone who participated in this panel. Pavel, Charlotte, Nayantara, thank you for your tremendous remarks and for your time and effort in joining us today. Thank you as well, everyone here in the audience, for participating and for accommodating us for running over a little bit. But again, thank you all very much. And of course, happy to answer any questions offline. Thank you, everyone.